If not, we'll go to item 8, discuss if necessary to take action on services agreement with medical management professional.
Let me talk about this a little bit. Actually, I'll give credit to Chris too. Ron had a contact that he referred to us about this. And I'll let Michael tell you about it here in a minute. It was about lab, and I've pretty much already told you everything I know about lab. But this is I guess a venture that this group is involved in, and what they're doing, they're primarily dealing with organizations that have started a wellness program similar to what we had here, where as a part of that wellness program you had to get a baseline lab for all the indicators. They're working with different facilities that provide these, and also with physician offices, and then they're looking for labs that they can refer these samples to, and will run the labs for them, and then bill them, and then share the revenue. Michael, why don't you tell us a little bit more about it?
Yeah, it's basically kind of acting as a mini reference lab. There's been a lot of the larger corporate labs that are out there. There's a lot of concern with getting your turnaround times the way, they're wanting a 1 day to 2 day turnaround time. And with some of the bigger labs, getting those turnaround times and plus the customer service when there is an issue, you're calling North Carolina to talk to somebody, and then you get transferred 10 times and still can't get the answer. So what they found is by going to the smaller labs, you get better customer service, and they can get faster turnaround times on these things. So they're kind of utilizing the smaller labs as a reference lab for this testing. We have the capacity and the capability to do that without any real additional staff at this time. We're set up and can perform. It could, if the volume's there, we could bring additional analytes on. I think that would service our patients, our traditional patient population better as well, if they can provide the volume there. But the only cost in that is just a box of reagent. I mean, the analyzer already does a vast number of tests that we could bring in, so there's really very little cost associated with this. And the volumes, it'll just depend. But we have the capacity to withstand a great deal of volume. A lot of it would probably be tested in the evenings and nights during our kind of downtime from the clinic. So.
Is there any, sure, you've spoken to them about the numbers they propose sending your way?
They're kind of anywhere from, we're talking 1,000, maybe 3,000 a month. Right now we're doing about 10,000 tests a month. I believe we could take a capacity of maybe an additional 5,000 without any additional personnel running them in the evenings and nights. It's just a matter of they're already somewhat prepped, so just getting them prepped and put on the analyzer, we can load it up. We can put 100 at a time on and run through pretty quick. So it'll be interesting to see. It's kind of a new project, so what the volumes actually are, but seems to indicate that there's some significant volume already in waiting. So,
but you'll have the potential to say no more.
If it gets to be too much, if we got to add another person, but if it's cost effective in doing that, we're making enough money off of it and justifies it, then we can do that. But as far as the automation and the analyzers and stuff nowadays, you can load them up and let them run, and they will handle the load. Just to kind of add, there's no Medicare, Medicaid involved in this. It's all commercial insurance type things. So.
And since it is a contract, we referred it to Kevin Reed's office for his evaluation. We received a preliminary, letter back from them, telling us that we need to be looking at, and one of those was Medicare, Medicaid. We were reading Medicare, Medicaid patients. The answer to that is no. So that clears a pretty significant hurdle on that. We reviewed the contract. I've asked Ron to take a look at it, and as a follow-up, we have a conference call in the morning, at 10 o'clock with Trent Trinke, who's in Kevin Reed's office to review the contract specifics. There's some you know, there's some questions that we have about it, and we want to address anything that our attorneys ask us to look at. So we're gonna follow up with this some more, hoping to, at the time when we get a green light, that we'd be able to move forward on this. Any questions about it, or it's one of those things that from our perspective, couldn't come at a better time. It's an opportunity to generate some additional revenue. We do want to make sure that we're doing things right and proper, even though there's additional revenue involved. So that's why we've asked Trent to help us analyze the contract.
I think it sounds like a good deal, with the exception that I saw in here, where they take 75% of the revenue.
That's the way it works is we do the billing. It's done through our contracts, and they either them or us will provide the biller, but it's billed on our contracts. It's billed on our tax ID and our provider numbers. 50% goes back to the referring entity, whoever that is, the ones that's providing the patients. 25 goes to this company for their management of it and for their marketing expertise, and then 25% comes to us for running the test. In addition to that, we're reimbursed our costs of reagents and any additional incremental costs that we have associated with it. But the numbers are pretty big. We know, and I can't tell you who, but we know of a hospital where they started this program. We call that hospital. We talked with them, and Michael's talked with the lab director at that hospital, and it seems to be working well for them. So I guess what I would ask you, if you're okay with it, to let us complete our evaluation with the attorney, and once we get a green light on that, if you'd authorize Ron to sign on behalf of the hospital district on that.
You need a motion to that effect?
Yes.
I'll make that motion to authorize you to make the final decision and sanction the agreement.
Motion by Margaret Wright. Do I have a second?
Second.
Second by Dwayne Griffin. Any further discussion? If not, call for the vote. All in favor? 6, 4, no against.
We'll move forward. We'll keep you advised.